Welcome! Today, we're going to dive into something pretty cool, the art of the physical exam. We're going to explore those skilled, hands-on techniques doctors use to figure out what's wrong, often without any high-tech gadgets at all. Right? It can seem like some kind of medical magic trick, but it's not magic, it's just really elegant science. So let's get into some of these physical exams that help diagnose common sprains, pains, and injuries. So first up on our tour of the body, we're talking about an injury that pretty much everyone has had, or at least knows someone who has, the classic twisted ankle. This is the #1 question, right? Whether you're on a sports field or you just tripped on the curb. And it turns out there's a really specific set of rules to help answer that without rushing you off for an x-ray. They're called the Ottawa ankle rules. And this isn't just some old school trick, it's a highly researched and super effective way to assess a fresh ankle injury and decide if an x-ray is even needed. The process itself is surprisingly simple. First, the doctor will gently press on very specific bony spots around your ankle and on your foot. They're just checking for tenderness. After that, they just ask you to do one thing. Try to take 4 steps. That's it. Now here's where it gets really impressive. That simple process has a 97.6% sensitivity. What that means in plain English is that the test is extremely good at finding a fracture if there is one. So if the test is negative, you can be almost certain your ankle isn't broken. And that's the whole point. This straightforward, hands-on test helps doctors avoid ordering unnecessary x-rays, which saves you from radiation exposure and helps keep medical costs down. It's a perfect little piece of clinical efficiency. All right, let's move up the body from the ankle to the neck and head. We're going to look at how a physical test can diagnose a totally different and really disorienting kind of problem. You know that awful, intense spinning sensation where the room just seems to tilt? That's vertigo. And for really common type, called BPPV, it's actually caused by tiny little crystals getting knocked loose inside your inner ear. And believe it or not, there's a simple maneuver that gives a clear diagnosis right on the spot. This is it, the Dix-Hallpike test. It's considered the absolute gold standard. Now what's interesting is that it's designed to safely and intentionally trigger your symptoms so the doctor can observe a really key reaction. So it starts with you sitting up on a table. The examiner will gently but firmly turn your head about 45 degrees to one side. Then, in one smooth, quick motion, they'll guide you backward into a lying position. Your head will be tilted back slightly over the edge of the table, but still turned to the side. And here is the crucial part. The examiner is watching your eyes very, very closely. They're looking for a specific involuntary fluttering or jumping movement of your eyes. That's called nystagmus. And this is the aha moment. If your vertigo comes back and that specific eye movement appears, the test is positive. It confirms which ear is actually causing the problem. It's a perfect cause and effect diagnosis, right there in the clinic. Okay, let's move on to a really complex joint that a lot of athletes and active people are, unfortunately, pretty familiar with, the shoulder. That unsettling feeling, like your shoulder is about to just slip out of its socket? To diagnose that instability, examiners use tests that carefully stress the joint to see how well the ligaments are holding everything together. One of the go-to methods is called, fittingly, the apprehension test. The examiner brings your arm up and out to the side, bent like you're about to throw a baseball, and then they carefully rotate it backward. And the name of the test tells you exactly what a positive result feels like. It's not usually about pain, it's about a very distinct feeling of, well, apprehension. It's the fear that your shoulder is literally about to pop out. Now let's look at the data here. The test sensitivity is okay, but check out that specificity. Over 95%. Specificity tells you how good a test is at ruling out a condition. But in this case, it means if you do feel that apprehension, it is a very, very strong indicator that you have shoulder instability. All right, let's move down to the powerhouse of the lower body for one of the most feared injuries in sports, an injury to that crucial ligament right in the middle of the knee. For a suspected ACL tear, the Lockman test is widely considered one of the most reliable and accurate hands-on tests out there. So, with your knee bent just a little bit, maybe 30 degrees, the examiner stabilizes your thigh and gives your shin bone a gentle pull forward. What they're feeling for isn't just movement, it's the quality of the stop. A healthy ACL has a firm end feel. A torn one feels, well, soft or mushy. And the numbers here are just fantastic. With 85% sensitivity and 94% specificity, this simple pull gives an incredibly accurate diagnosis. It often means an MRI is just confirming what the examiner already strongly suspects.
So, we've gone from the ankle to the neck, the shoulder, to the knee. After looking at all these different tests, what do they really tell us about medicine today?
I think they prove that even in our world of MRIs and CT scans, a trained set of hands and an observant pair of eyes can gather incredibly powerful information, fast, efficiently, and without any expensive machines.
It's really a beautiful reminder that there's an art inside the science of medicine. It's about blending that deep knowledge of anatomy with the kind of real-time feedback that only human touch can provide.
When you think about it, these skilled exams are really just a formal way of listening to the body's signals. And it leaves you with a final thought, doesn't it? What could we all learn about our own health just by paying a little bit of closer, more curious attention?